Good afternoon, everyone. Dear delegates, our esteemed faculty, and office bearers of the Haemophilia Federation of India. On this occasion of World Haemophilia Day, I welcome each one of you for this particular case-based conference, which we have arranged to help us to improve haemophilia care in our country. And I hope that every one of you truly benefits from the expert faculty which we have lined up for you over the next 2 hours. This year, the theme for the World Haemophilia Day is Adapting to Change, Sustaining Care in a New World. As all of us are aware, the COVID pandemic has taken over our routine lives to such an extent that we all have to adapt to a new normal. And thus, even haemophilia care has had to adapt to this. We therefore encourage our patients to avail of teleconsults, to become self-sufficient for factor infusion, and to remain in the safety of their homes as much as possible. Of course, it goes without saying that all the other precautions for COVID must be strictly followed by everyone. I hope over the next 2 hours, will be really informative for all of you and will help you in improving the care of haemophilia patients under you. To start with, we have Dr. Prantar. We have a very esteemed faculty, Dr. Prantar, Dr. Judy David, Dr. Mohanty, Dr. Chandrakala, and Dr. Rucha Patel, who will be speaking on various topics which are relevant for haemophilia care. Before we go on to the actual faculty, we have made a short educative video on haemophilia care, and this has been done by our platinum sponsors, Takeda. I would encourage everyone to go through this video, as I'm sure it is going to help us in taking care of our patients. Thank you.
Haemophilia, journeying towards a life without bleeds. What is haemophilia? Well, when we get a bump or injure ourselves, our blood vessels can become damaged, causing a bleed. Most people don't notice this because their blood contains clotting factors, which work quickly to stop the bleed. But people with haemophilia, like Tom here, don't produce enough of these clotting factors. This means that Tom's bleeds last longer than most people's. Depending on where the bleed occurs in the body, some bleeds can require a hospital visit or even be life-threatening. Bleeds can happen anywhere. But in people with haemophilia, they are most common in the joints, where we move the most. When joint bleeds occur, they can cause painful swelling, inflammation, and damage. And sometimes bleeds just happen with no obvious cause. And it's not just pain that can affect Tom and other people with haemophilia. They may miss school or work, possibly from being bedbound because of a severe bleed. They may also miss out on spending time with their friends. And just 2 or 3 bleeds in the same joint can cause long-term damage in some people with haemophilia. There are thousands of people with haemophilia all around the world, and almost all are male. And their haemophilia can be treated by replacing the clotting factors which they lack. Regular infusions of medicine provide clotting factors in the blood to try to prevent bleeds before they happen, rather than treating them afterwards. This approach is called prophylaxis. The ideal goal for anyone with haemophilia is to live without bleeds. So prophylaxis is recommended by the World Federation of Haemophilia for people of all ages and backgrounds. The importance of personalized care. The key to successful prophylactic treatment is matching the right dose at the right times to the right person. Everyone with haemophilia is different. Their age, body, weight, activity levels, and genes all affect how much clotting factor they need and when. So they each need different treatment schedules. In other words, it's helpful for people to have a personalized care plan made just for them. The path towards that plan starts when Tom chooses not to compromise. He wants to avoid the painful and limiting effects of bleeding and to live life on his own terms. This decision leads Tom to his doctor. Together they talk about moving closer to a life without bleeds. That's when they discuss a personalized care plan. By reviewing Tom's unique characteristics, like his medical status and lifestyle, his doctor can decide how much medicine is needed and when it should be taken to better protect Tom from bleeds. A treatment plan is developed that is tailored to the rhythms of Tom's body and his life. Then Tom's on his way. With the support of his medical team, his friends, and his family. Together they track how well his treatment is working, and his doctor adjusts it when necessary. Ultimately, Tom wants more freedom to enjoy life with the people he cares about. He wants to look forward to his future and worry less about when the next bleed is going to happen. If you have haemophilia, talk to your doctor about personalized treatment options to help you prevent bleeds and protect your joints.